wetu ambaye ni msomi, ambaye hutaka kufanya mambo mwenyewe, ndio huyo. Tumpigie makofi. Asante.
Dr. James Mwangi led from the front. He donated 300 million shillings of his own money and that of his family into the kitty. He then enjoined Professor Mudhure Masharia together with all the shareholders of Equity Group, who then also donated 300 million shillings. On top of that, they leveraged their connections and networks and brought MasterCard Foundation, who offered 500 million shillings. So together, the Equity Group Foundation donated 1.1 billion shillings. This consignment we bring to you is the first consignment that has been bought worth 237 million shillings, and 68 hospitals across the country have been identified as priority hospitals. And I'm very happy to say this hospital is one of them. And therefore, that's why we are present here today. Your Excellency the Governor, as I speak to you, they are very busy. Our teams are very busy sourcing the next batch of 400 million of the same equipment. Because our frontline workers, the doctors, the health workers, one COVID patient, and you'll perhaps Dr. CC, you'll confirm, one patient requires maybe 5 to 8 people to deal with them at any given time. And those 5 to 8 people must be adequately dressed. They must be dressed from head to toe to protect themselves. And maybe some of us, wananchi, are not understanding the commitment of our doctors. They are not very comfortable inside those suits. They have to wear those suits, and I've just been advised recently that they also don't go home. And you, Your Excellency the Governor, you know you're bearing that cost. You also have to accommodate them and pay for them to stay in a special place for a few weeks before they see their families. Now, who else can do that for you? Can we please clap for the doctors and the health workers? That's why we at Equity Bank have single-mindedly said, you are our concern. We shall work with you. And we appeal to government to let us all aggregate every single resource towards enabling, capacitating, motivating, energizing these doctors and nurses. We cannot control the way this thing is spreading. Even if we try to control it too much, we have seen it's a delicate balance between lives and livelihoods. The only people who can help us are the doctors. But I also want to reiterate the message that the county commissioner and you, the governor, have said. There is no law or custom or tradition that can protect you from yourself. Washing hands is a basic thing. Wearing the mask is a basic thing. Doing all the protocols that is expected of us of social distance is a basic thing. We need to do it because we can't produce more doctors than we have. And this pandemic is with us for the next couple of months, maybe 1 year. And therefore, Governor, I'm giving you the message of the background to this material and telling you this is not tokenism. We've not just come here for social responsibility. This is investment in society, and that's why we exist. We have an obligation to do what we are doing. We believe we are in an unprecedented time of survival. All of us must survive. This is survival time. And when it's a season of survival, Governor, I like what you said. There is time for mchezo. Yeah? Where I come from, we say, where he grow Iverona kahede meruka. Because I am mchezo na saa this is not time for jokes. This is time to really get very, very serious. And therefore, I agree with you. I come as a bearer of gifts. Your Excellency the Governor, my third message. I am now distinctly honored and very highly privileged to present to you this first consignment to the people of Tharaka Nithi County, to the health workers of Tharaka Nithi County. This humble donation from the Kenya COVID-19 Fund and the Equity Group Foundation. And I would like to invite 2 models to stand here. Madaktari tafadhali, the ones who are kitted, if you can just come and stand here. We are presenting to you the hair net. They put on a hair net. Then they put on a mask to go with it. Then they put on surgical gloves, and they put 2. When they are going to see the patient, they actually put 2. Then they put what they call a scrub or a gown on top. Then they have another scrub. They put on gumboots. There's one more missing. They even put another cover on top of the gumboot. This is not cheap stuff. This is expensive. Your Excellency, the Governor, we have gone further and worked with, and I'm sure they are here, Kenya medical practitioners, KMPDU, nurses, clinicians. They have verified the quality of this material. The material we bring you, Your Excellency, the Governor, you'll be pleased to know is manufactured in Kenya. 99% of what is being worn by these doctors is manufactured in Kenya to the highest standard. EPZ at the river, Kikuyu, Nakuru, Kitui. It is our people and our labor that has produced this. Tujipigie makofi. So the Energy, Kenya COVID-19 Fund, and Equity Group Foundation, actually we have trained all these manufacturers through a program with the IFC, and we have further even put 85 million shillings of psychosocial support training to the doctors. That is being done to the doctors. So we are telling all the counties, our mission is these health workers, and we really want to thank them. I also forgot to mention that they also have eye goggles. In addition to the screen, there is also eye goggles. So asanteni sana. Governor, ningekuomba upigwe picha moja hapa tukiwa na county commissioner pamoja na CC, kisha tujongee pale. I present, tafadhali.
Protective equipment procured through the efforts of leadership of Equity Bank Group. I would like to express my personal gratitude to the Equity Bank Group and others that contributed in one way or another to procure and donate these very important and necessary commodities to be used in the fight against COVID-19. Health workers are the frontline fighters against COVID-19, but they need to be protected from contracting COVID-19 infection themselves so that they can continue offering services to protect us from being infected by COVID-19 virus and at the same time caring for those that contract the disease. We will continuously need and require sufficient supplies of N95 masks, respirators, protective goggles, latex gloves, face shields, wipes and disinfectants, coveralls and gowns, boots and booties and other necessary equipment, pharmaceuticals and pharmaceuticals to assist our healthcare providers in fighting COVID-19. My government has already put in mechanism to address prevention of COVID-19 by continuously reminding our people to frequently wash their hands with soap and water, maintaining social and physical distance of at least 1 meter, 1.5 meters from one another, wearing face masks all the time when they're in public, and covering their noses and mouth, avoiding crowds and agreeing to be screened whenever they find the opportunity. That has been one of our greatest problems in Kenya, people avoiding to be screened. We also have trained our healthcare services providers to trace, track, test all the suspected cases of COVID-19 and other infections that are opportunists while we fight this disease. Tharaka Nithi County has a total of 488 isolation facility beds, and we still continue to be vigilant in taking samples from suspected individuals and groups of people who may have had a close contact with COVID-19 confirmed positive test cases. I would like to once again thank Equity Bank and Equity Bank Group and other partners who have contributed to the procurement and donation of the PPEs. On behalf of the Tharaka Nithi people, I express our gratitude and also request other individuals and organizations join hands in our county in fighting COVID-19 pandemic. Allow me also now to thank the medical team, the frontline workers from Tharaka Nithi in particular, We got our first case last week, and I expected them to be a very worried lot. I expected them to be hesitant. I expected them to probably mark time, but I'm told yes, they did that for the first 1 hour, because when we got our first case, it took a few hours for them to decide whether to go for the case or not, but which is normal. Human beings sometimes fear. But I'm told from the day they picked the first case, it's been all the systems go. Dr. Nduraku, sometimes it's good to tell the truth, that our people are also human. The reason I'm saying that is because the only reason why our people would fear, not just because they're human, but probably they were not aware that they were well protected against contracting the disease. Our government has worked tirelessly in ensuring that we have protective gear, which of course sometimes get exhausted or rather finished, and we are happy when we are getting more people coming to contribute to give us more PPEs. So the team that is headed by Dr. Nduraku and your CEOs, and of course the director and the hospital heads who are represented here today by Dr. Maureen, we appreciate you.